All right, I guess we're going to go ahead and get started. So thanks everyone for attending today. This is PFAS and Consumer Products Part 2. And it's, first of all, congratulations to NUMOA for finally pulling off this wonderful conference that's been so many years in planning. It's my pleasure to, well, actually, I'll start with some reminders about continuing education credits. Some Massachusetts licensed site professionals and toxic use reduction planners have paid to obtain continuing education certificate for attending this conference. So if you're one of those people, you need to verify your attendance by checking in at the registration desk 4 times per day and initialing the form first thing in the morning, before lunch, after the lunch break, and at the end of the day. So we're at the end of the day session. Mass LP CEC certificates will be handed out at the end of the conference. NUMO will not give out the certificate to those who are not present at the end of the day to pick it up. There are no partial credits for late arrival or early departure. So with that announcement, I'm glad to introduce Thomas Salimeno. So Tom has over 30 years experience providing professional services, combining chemical and environmental engineering and site investigation and remediation expertise while navigating the Connecticut remediation standard regulations as a licensed environmental professional. He's L'Oreal's principal engineer in the environmental assessment group and a technical lead on emerging contaminants, including per and polyfluoral alkyl substances. You think I know how to say that by now, or PFAS? He provided strategic and tactical direction, technical expertise, and leadership on environmental investigation remediation products for an engineering, consulting, and construction services firm. He is responsible for the development, planning, and engineering evaluation and design of solutions for investigation and remediation projects. Tom also has expertise with state and federal environmental regulations, hazardous waste, wastewater cleanup, and other things. So, so thank you, Thomas, and welcome.
Thank you. I'm used to doing this as a sit-down kind of comedy show, so please bear with me. I get a little nervous when I get going. So if that's what I do, I don't know what I think what I really do is I watch butterflies, hummingbirds, and unicorns. That's what I chase. People ask me questions and I get distracted. I go and look up the answer. I go try to find some more information. I go and look. So what you're going to hear today is you may not hear anything new. You might hear bits of everything. Hopefully on one hand, it may affirm what you already know, but the other thing it may do is say, hey, let me go figure that out. Let me go look somewhere. Let me go find it. Because a lot more smarter people here than I am. And I think we've heard that, I can't remember the saying earlier today, together we're all smart together, or something along those lines. But that being said, there is a lot of information. There's, it's information overload. And I think, if we kind of just, take it bit by bit, we can get through it and just kind of keep the thought process going about what we're doing. Hopefully, clear direction. So why are the historical uses important? Because right now it's the most dynamic emerging contaminant that we have. It's everywhere, it's forever, it's everything. We know a lot about where it is, but we know even more what we don't know. Somebody I talked to once said, I don't even know what I don't even know yet. So it's everywhere, but all the studies that we heard about today, we'll hear about later on, we're finding it more and more places. That's going to help inform us what we need to do. But I think some conversations that we had earlier today, different people, it's not just what we find, it's really using that information to generate maybe policy perspectives of what it is that we could do, should do as a society. Fate and transport, not going to talk too much about that. Regulatory status, still heavily evolving. The feds were initially a little slow going, ramping up. A lot of the states are taking charge and developing a lot of good regulations and working forward with that. Treatment technologies, yeah, they're proven, some mature, a lot of new stuff coming on, a lot to happen. But from my perspective, it's who, what, when, where, why, and how. Let's try to answer some of those questions and see where we go with that. General background, we know, all right, PFAS used in the 40s, manufactured up until 2010 and 2015 in the US. But we also know where the largest producers and uses right now. Overseas, China, India, Russia. So what does that mean? So If I talk to Tiffany, okay, worry about something coming into the States, a product coming in or replacement product, or, all the shortages, where else is it coming from? So it's certainly a global issue. Yeah, studied early since the 1990s, gained traction in the 16 or so, in the news in Connecticut, but it's all across the state. I'm focused on Connecticut myself, but obviously this is New England, and it's all the United States, and again, it's the whole world. As I said, the Feds started slow, certainly getting a lot of traction, making good progress. States similarly. Where did it begin? And I don't know if it really began here, because I think if I did some research, I think it started at Penn State. I think one of the original chemists was from Penn State, and he went to 3M. This is, I think, the building at 3M first started in 1911. Why do I say that? Because my kids ask me, Dad, what do you do? I'm an industrial archaeologist. I try to figure out stuff, where it came from, why is that important? Because it's going to help inform us to where we need to look for it, what's important, how it was used, where it could be. Because I think we need to know all those things, because we just can't test everything. We have to test what makes sense. We're hearing, in the product end of it, we can't test everything because, it's costly or whatever. So I think we have to make informed decisions for a lot of what we do. What's industrial archaeology? It's figuring out, it's looking at history, looks how we did things. I think we had a couple of conversations today at lunch where we talked about how, we started a certain process, how do we degrease something? Well, we use gasoline. Well, that's a problem because it starts fires. Then we get to safety solvents and chlorinated solvents, and well, that's a problem because they last forever. So we switch to something else. Maybe now it's alcohols and something else, but it's making smart solutions, making smart substitutions, looking at the process. And I think yesterday in some of the talks, we heard a lot about that, about, let's do real investigation, real evaluation, and make those sustainable changes slowly, not knee jerk. Yeah, we have to make some of those too, but let's think about it. Beginning, one of the patents, do not go on Google Patents. Don't start, I'm just warning you right now. If you're going to do it, just sit down on a Friday night or Saturday night when your spouse is watching something you don't want to watch, then you can start. At the end of every patent, there's a bunch of numbers. That's where the predecessor information is. This is 3M's with their electrolysis of for Pfas compounds, 1948. And I think there's a predecessor patent 1930, so it's around, it's there. Unique chemistry, that's the beauty of it. People found this great stuff. It works, it's very stable. It great ingredient, provides a lot of the properties that we want and we need. Or at least we thought we wanted and we needed. And now we realize, well, okay, yeah, we liked it, but is it really what we thought we wanted and needed? That's why we're here, because maybe it's not the best thing that we thought we wanted and we needed, but it is something that we have to find something to replace it, whatever. I mean, I grew up in Wesley, Rhode Island, Stonington, Connecticut. In Stonington, it was Pfizer, better living through pharmaceuticals, whatever. So, but yeah, I mean, it's an evolution. We need a lot of these things, but it needs to be in a reasonable, appropriate fashion. And we need to address those things, the mistakes that we've made and what's out there. And I'll give credit, ITRC is a phenomenal resource. Some of the information they put out there, you can't be beat. Even now it's great because they're aggregating some of the sources that I chased down years ago. If you go to Minnesota and you read about the 3M lawsuits and some of the resources that are there. Again, do it on a Saturday night when you don't want to watch TV and you just keep going down the path. But why do I talk about some of those things? It's because we have to understand the past to improve the future. Somebody else say that? I don't know. But for some of this I put out there because it gives a perspective of the time frame. Everybody either thinks it's a certain date. There's nothing hard and fast. There's a time frame. If you think it started in 1990 or 95, maybe it was really 75, because people started doing it before they said it to anybody else, because they didn't want to lose their competitive advantage. If people said they finished it, later on, well, maybe they still had some stock they had to get rid of, or maybe they wanted to do something else, or who knows. But it gives a time frame for these different developments. Fantastic nonstick coatings and waterproof fabrics. Again, different time frames. Just keep a wide view on it. Approach, who? I mean, approach to, if I'm looking at a site, or if I'm looking at something, the 5 Y's and the H. Who? If I do industrial work, but to me, it also translates to consumer work. And I'll use some examples later on. But the business identification, excuse me. I'm talking too fast, I get a little excited. Business ID, what's the business? What do they do? What do they really do? Source identification, what's the process? What do they do? Whenever I talk to somebody, whether it's somebody early in their career or not, it's like, okay, put your head into the business and think about what they're really doing. Why are they doing it? How are they doing? Well, I'm just doing a phase 1. It doesn't matter. Well, I'm looking at a 1920 US sandborne map. What did the operation do at the time? If I look at it, I can understand, this is where the industrial archaeology comes in. Now I can understand where the site investigation, remediation may need to occur. Also, the other side, the consumer side of it is, I also need to understand, well, what are the risks? What are the drinking water sources? What's out there? I'm looking at both ends of the spectrum. So source evaluation, understanding history, source investigation, site and facility considerations. This is all going to be repeat, but I feel I have to do it. The obvious sources, AFFFs, metal plating, industrial products, oil, water repellents, and consumer products. In all the other talks along this track, we've heard all about most of them, about the foams, AFFF, great stuff. It works, it keeps the fire down. Now it's the risk-based analogy. And we've worked our way through from the legacy foams to teleformer foams to the fluorine-free foams. It's a process. I think Shannon was up here earlier today talking about what Connecticut has done to work their way through their process. I think many of the states are doing the similar thing, maybe different tracks, a little bit earlier, a little bit later, but we're all working along that same path. And in most cases, most of the states were only dealing with the public firehouses, the state airports. Let's not forget the industry that's out there. Connecticut has a rule, I think, end of 2022, that they have to, or 2023, I think you can get an exemption for an extra year if you're a private facility for use of AFFF legacy foams, or having to go to the fluorine-free foams. Metal finishing, here's one where I chased a bunch of rabbits. Surfactant wetting and mist suppressant. Okay, everybody talks about chrome. We go to a patent, there's a 1958 patent. It's a regulatory requirement in California. It was in 88, on the federal level in 95, and we got rid of it in 2015. But wait a second. Platers, they're smart guys. They don't want to waste their solution. They don't want to spend money. What can I do to save myself a little bit of money? Let me put something in there so the drag out is reduces the surface tension. And so now I don't have to pay to replenish that bath as quickly. Okay, so, and that goes through any of the products that we talk about today. Somebody was smart and said, there's got to be a better way, an easier way, a different way. Oil and water repellent products, all the textiles. I think we'll hear one on fire coats, a little bit, firefighting apparel a little bit later. Again, great products. I'm sure my household, we use a lot of them because I was such a slob as a kid growing up, but that's a different issue. And we heard some talks yesterday about the food packaging. I'm actually glad that I don't like popcorn. I'll just go on record as saying that, and I don't eat popcorn, and I have to just keep reminding my family that that's the case. Now, if it's Cheetos or something else, other industrial and consumer products. I mean, so, convenience and cost, or convenience and durability. So it does all come into money. into products that people want, they're going to find serviceable and they're going to use. So, what additives can I put in there? Oh, wait a second. I think paints and coatings, did they used to have PCBs in them? Oh, okay. Now it's PFAS. Okay, it's something. But it's a great property. I think I have a 1949, I'm gonna call it chemical recipe book. And it talks about the production of different shellacs and varnishes and whatnot. I don't remember what was added, but it was something that worked for a period of time until it didn't work and we had to add something else. Now we have to find the next best thing. Consumer products, again, we talk about all of them everywhere. But so with all those products and materials, there's, again, go to the patents, there's a lot of smart people out there. Some company, blank company, I create this product, and it ties right back to the 3M 58 patent. So they're going to make a polishing compound durable for automobiles. Company also ties back into car waxes, came up with some other cleaners, but wait, this company is so good at creating these products, I need an industrial division as well. But okay, then if I go in, and I'm not picking any names per se, but if I go and pick on any consumer product, what is it? SK Johnson, go look for their patents. Obviously 3M, but go and look at any wax, any polish, any liquid, look at any product where you're looking for the same physical properties, that repellent characteristic, that reduce the surface tension. And I think those are the reasons why we're still finding them in today's products, is because we think we need them, we think we want them, and we have to find the way to realize that maybe we don't need them, maybe we don't want them. Whether it's, I think, again, another brief conversation before this, it's, are we chasing both ends to the middle? So we're chasing on the product end and saying, hey, test, you got to get it out of here. But also maybe it's on the policy end and be able to say, hey, we need something else. We need a better answer. So we're not having to chase all these butterflies, hummingbirds, and unicorns. Save me the trouble. Conceptual site model, just going to go through a couple of little examples. Again, mine's industrial commercial, but I can take this to any particular site. Manufacturing site, where might I have PFAS compounds? In metal finishing areas, which ends up in the waste management areas, which ends up in waste treatment areas, wastewater treatment, process vents, we've heard about some of those, up on the roof, stormwater management areas, spills, whatever, stormwater detention basins, on-site sanitary waste discharges. So the last couple are ones that I might find those at a residential property. So, one of the AFFF sites that I was dealing with was a concern with, it wasn't a big site, but there were half a dozen private wells within 500 feet of that particular location. Each of those properties also had their own on-site septic system. Okay, so if they were big on all of the consumer products, might we also have those issues? So we have to take both of those into considerations. In this particular case, I believe all the wells were deep bedrock wells. They may not have had an issue with their on-site septic system, but I think one of them may have actually been a shallow dug well. Different issue, something to look at. Have to look at all the information. Summary. For me, it's business ID, but okay, site identification. What do I have? What am I using? What might it be? Source identification. Is it a resident? Well, what's nearby? Is it a source evaluation, site facility history, source investigation, site facility, site considerations? What's next? I don't know. I don't have the answer. I don't have any of the answers. But is it minimize, eliminate risk, develop, implement safer replacements? It's a question that we all have to ask ourselves. I'm not a big philosopher, by the way, but that's it. Thank you.
Thanks, Tom. That was wonderful. So next I'd like to introduce, we have two speakers. Maybe we need to, do we need to, why am I getting feedback? Doesn't matter. Oh. How's this? All right. So I'd like to introduce Kristen Mello. Kristen Mello has a bachelor's MS, has a bachelor's degree in chemistry and a master's degree in analytical chemistry, specializing in chemometrics. She's the director of the Westfield Residents Advocating for Themselves, or RAFT, a community group formed in response to the PFAS contamination of Westfield's drinking water from AFFF use at Barnes Air National Guard Base. Kristen led the effort with RAFT to get PFAS blood testing for Westfield residents and served on the Mass DEP PFAS MCL stakeholder group. Her PFAS advocacy work, in large part, led to her being an elected Westfield city councilor at large in 2019 and 2021. And she will be speaking with Graham Peasley. Graham Peasley is a professor of physics at the University of Notre Dame. He leads an active research group in the area of applied nuclear science, where he brings established nuclear measurement techniques to pressing environmental issues. His interests include the detection of total fluorine as a surrogate for PFAS, but also rapid screening for materials for heavy metals and other chemicals of concern. He has more than 229 peer-reviewed publications, most with student co-authors. He earned a bachelor's degree in chemistry from Princeton University, as well as a PhD in chemical physics from the State University of New York in Stony Brook, New York. So, welcome, Kristen and Graham.
Thank you so much. I am going to keep my video off while I share our screen. And if someone could just unmute and let me know if you can see this.
We can see it.
Excellent, thank you. So as you said, I am Kristen Mello. I'm the director and co-founder of RAFT. We were formed in 2017 in my living room in response to the PFAS contamination of our water supply, but also at the same time, there was before our planning board an application for a turf field that residents were very upset about because of crumb rubber. So this is why I am speaking on this. And as it turns out, we fought the fight against crumb rubber because somehow in Massachusetts, 44,000 commercial truck tires in a pile are hazardous, but if you grind them up, they're not considered hazardous. So we thought that was a fight worth fighting, but we lost that fight. And so I gave up and we just focused on PFAS. And then in 2019, I got a phone call. The lady with the red hair there is Tracy Stewart, and she was a friend of mine, and she said, Kristen, I need your help. There's PFAS in the turf. She and Kyla Bennett had gone out and they took some samples. And I said, Tracy, how do you know? Did you know, who tested them? How do you know? And she said, Graham Peasley told us. So I'll mute and let him take over.
That's a nice introduction. Thank you, Kristen. And I apologize, everybody, that we're not there in person, but this is what we had to do on a short notice. The question comes up, why is there PFAS in my turf grass? And that's something that we've looked at now, dozens of upward of 50 samples from different turf grass fields around the nation. And we have a technique, with all due deference to Thomas, who just spoke before us, we do measure everything. So we have a technique, if you go forward one slide, Kristen, we are going to use an accelerator and actually look at total fluorine as a surrogate for PFAS. And this allows us to put anything, we bring it out in the air, we put all the samples on a wheel, and we can run through at about 3 minutes apiece and look for the presence of fluorine very sensitively. And solids are what we measure. So we concentrate lubricant samples, but that means that we can look at things such as turf grass, and we just put the blades in the beam, and we can see that there's fluorine or present or absent. And the signal is shown there for a typical copy of paper, which doesn't have fluorine, and a popcorn bag, which does, and it's pretty easy to tell which one is fluorinated. You have to have a significant amount of fluorine there, but we have got constant, it's quantitative, so we can tell you how much. If you go to the next slide, let's see if we can go forward one slide. Yeah, there you go. So this is the result of the first 20 samples that we were sent of some turf grass samples. And what was noticeable is that none of them were zero or below detection limit, which was around 10. And so this is in parts per million. So that's a lot of fluorine, but it's not enough to be what you'd say a primary ingredient. It's not percent levels, which we can also measure. And we can confirm this by going through Pfas extraction, doing top assay and converting and looking at it with an LC mass spec, but that takes time and costs money. To screen these things, we can do them in 3 minutes apiece. These took an hour to screen all these samples. And with the exception of the two that were rather heavy, all the rest of them were very, very similar. Within our statistical error, I'd say they are all the same, but they were somewhere around 100 part per million, which is large enough to be of interest, but low enough to say it isn't a primary ingredient. So what could that be? Let's go to the next slide. And I mentioned right now that all these slides are coming from Heather Whitehead. That's my great graduate student who's been working on this for the last few months and is putting this into a rather large project to find out where it came from. Where does this fluorine come from? It's there, we know it's there. And so we went to the web. Where else do you find these things? But polymer processing aids came up right away. If you look in to major manufacturers, which 3M is one of them, and they are used to make plastics which are extruded smoother and less wrinkly and also last longer. All the same properties you'd expect from a material. And if you use their polymer processing aid, you get the wonderful material. If you go to the next slide. The way it works is that these are the polymer processing aids are made up of between 1/3 or 2/3 or even 100% of a fluoropolymer. So you add a little PFAS into your plastic that you're extruding. So all those shopping bags you used to make that are polyethylene are now made with polyethylene with a little bit of PFAS in them. And these are the various types used: polyvinylidene fluoride and VDF, which is vinyl. I have to think about that. There it is: hexafluoropropylene and vinylidene fluoride. And so these are made into a bunch of products that are used in the US. If we go to the next slide, the process is quite easy to recognize. When you extrude plastic, you take plastic beads, you put them into a heated tube, and you squash them together under heat, and then you can mold them into any sort of shape you'd like, a mold, injection mold, or you can stretch it out as a film, as most of these soft plastics are set to. And if you go to an original turf grass that may have been made out of the shopping paper, the shopping bags, it's too thin in polyethylene to last, and they didn't last long enough. And the manufacturers would like a longer lifetime, especially with cleats running across them. So what they do is they made them in heavier duty plastics, polypropylene and polyhexylene were starting to be substituted at some percentage. And what happened was that those would gum up these extruders. This little metal piece at the end here is a thin vein that you get the film out of. And if you take 2% or up to 0.2%, I guess, say between 20 and 2000 ppm of this polymer processing aid, which is somewhere between 30 and 100% PFAS, you add it to your plastic, it does the same thing that PFAS does on any other material. It has a lipophilic side and a lipophobic side, and it just goes to the surface. And so it goes and lines the surface of the extruder, and without having to remanufacture an expensive tooling piece, you can simply produce these things with the same equipment, but with a little bit of PFAS to make it come out smoothly. And there's lots of examples of this. We didn't invent this. We, in fact, found it online, and it was being advertised as potential uses for it. If you look at the next slide, there are lots of uses of it: food packaging, grocery stores, liquid packaging, various types of chemical packaging. These are the main companies that sell it, two American ones, 3M and DuPont, and two foreign ones. And they suggest that if the 3M product, for example, had two of them that were suggested for the synthetic turf grass industry, which made our eyes open. We said, okay, let's see what that stuff is. And that is what we're trying to deduce. We'll go to the next slide. And this has been confirmed, and I'm going to let Kristen tell you the story from here.
Thank you so much, Graham. So the residents in communities that were considering turf grass, once they found out about the PFAS, and this was in the Boston Globe and the Intercept, came to me and said, okay, we've got these lab reports. We're trying to figure out what it is. People are saying that, there is no PFAS, but we finally have these two instances of where, the hired toxicologists have come to meetings and on the public record have said that it is a PFAS and what it is. And they told us it was PVDF. And in just December of this year in the city of Portsmouth, a manufacturer from Germany actually sent in the MSDS for the polymer processing aid that they were actually using. So we were able to look it up, and indeed here it is, PVDF HFP. Now we're going to pause just for a minute so the analytical chemist can get nerdy with you. When we look at the lab reports for the testing on these materials, it is important always to look at the detection limits and the reporting limits and what the regulatory triggers are. So especially when you're looking at materials that are not drinking water, you have a lot of matrix effects, and you know, they use surrogates in order to, you know, help us determine exactly what's in these materials and how the instrument is responding. But there is, you know, there's some work there, and there's some art to reading these materials and the data that comes out. And there is an art to separation science. And when you are working with regulatory protocol, labs aren't allowed to deviate. They have to do it exactly the way the protocol is written. And at an academic lab, sometimes, you know, they can change things in order to enhance your separation or get better times. You can look at things differently when you're in an academic lab, but when you're looking at lab reports that are done, you know, because people want to know regulatory numbers, you can only use the protocol that's approved. And when you do that, sometimes you get answers that have reporting limits that are much higher than they would be if you could actually, you know, tweak things in the lab yourself. So a methods detection limit and a reporting limit are very important to look at in these lab reports. And also you need to know that there is very limited data out here. So when Mr. Teeter went to Sharon, Mass. And said that nothing showed up above the reporting limits, these are the reporting limits they were talking about, and we are in nanograms per liter, right? Parts per trillion. So in the state of Massachusetts, you could have had this sample come back and it could have had, you know, just under the detectable amount, and it still would have hit the regulatory limit at above 20 parts per trillion. So, you know, these are important things to notice. So Martha's Vineyard, the Martha's Vineyard Commission also took a look at the field components. They looked at a leaching procedure and a top assay because they wanted to know about oxidation products. And you've heard, you know, for the last 2 days, different people talk about these sort of black box PFAS and the PFAS we haven't been able to identify and what isn't picked up, you know, by the LCM SMS. And, you know, so this is another case where we have a bunch of PFAS that we know we've got the fluorinated compounds, but we can't always see what we can't see. But what Martha's Vineyard was able to see when they looked were that there were PFAS coming off the materials and that there were PFAS showing up when they did the top assay. Now in Portsmouth, New Hampshire, they also, like Westfield, lost the fight against the installation of a turf field. In this slide, up at the top where the blue dot is, there's a new, well, few, I think it's about 8 or 9 years old, is it? The turf field up there. And when they did a test for total fluorine, they found out that, you know, it was pretty high, and they asked NHDES to go do some sampling, which they did. Now you can tell that this was not pristine water to begin with, but you can also see that the amount of PFAS is much higher closer to the field. And so what we did, because you can see in other instances that selenium, where tyrochrome is used, tends to also go up in these areas. Because there was tyrochrome in Portsmouth, we recommended that they test the water to check for selenium to see if they couldn't get an idea of how much of that PFAS is coming out of the field. So the pictures you saw earlier with my friend Tracy and Kyla Bennett are from Franklin, Mass. And those are the turf fields that you can see. And those turf rolls were piled up, according to Tracy and Kyla, over by where the light green dot is, just in the woods, right up, you know, this embankment from Mine Brook. So there is also a Superfund site in Franklin, Mass, and it is down at the bottom of that picture. The bottom graph is the PFAS from EPA sampling in various areas of the brook near the Superfund site. And up top is the PFAS sampling from the sample that Kyla and Tracy took from the brook, right next to where the rolls are. I would like to draw your attention to the fluorotellular sulfonate that's sitting there, because that's a precursor for some of the PFCAAs. So we also heard from someone in Woodbridge, Connecticut, who shared the data they had. They were upset about a turf field. They had a monitoring well and they took a sample before and after installation. This is where you see that selenium hit. And you can also see the PFAS that showed up after installation. And I'll hand it back to Graham.
So Kristen comes with a wonderful set of data, which is now collected from 4 or 5 different locations, and shows you the sort of numbers. She didn't emphasize them, but they're in part per trillion when you look at specific analytes, and in tens of parts per trillion if you sum them all together. And that can often reach regulatory limits. But more importantly, if you look at the total fluorine, we are seeing things in the part per million. So this is 100 times higher. A lot of that is probably polymeric, stuck as polyvinylidene fluoride, which, as you know, as industry's told us for years, it's safe, safe, safe. Well, it's true. You can't make polymers bioavailable, but the cofactors that come with them, these smaller chain molecules or degradation products from these things in sunlight, or in the manufacturing process, things like the fluorotellular sulfonates, or something perhaps ultra short chain or even volatile. Certainly coming along with these things and are getting out in the environment. So this is our theory, which we're trying to show hard to prove. We are trying to find what the missing mass is, of course, and that's the premise of Heather's thesis. So it's likely that these polyprocessing aids are sticking to or interlocutes into the blades of the grass, and it's there at some level. People will tell you it's trace, and it is. It's pretty small, but it adds up, and there's also a lot of turf grass field out there. You put down hectares of this stuff, and you will be able to get measurable amounts into your water. We measure short chain PFAS, particularly the fluorocarboxylic acids, but there's a lot of products, 90 to 99% we don't measure by LC mass spec. And we know that in environmental samples, and it's been shown by the total oxidizable precursor, say, for years, but also by other total fluorine measurements. So there is a bulk of other things there. We hope most of it is fixed and not coming down the stream, but we don't know that. It might be off-gassing, it might be soluble, and that's our concerns. And next slide. So we can both do this if you like, Kristen, but basically these are unanswered questions, of which this is why it's good to have a thesis student working on it. What are PFAS coming off? What other ones that we can identify, or even if there's a non-targeted analysis, we're trying that too. How fast do they come off, and what's the oxidation mechanisms? And what's the eventual, where do they end up? What's their bioavailability? And of course, the $64 question, toxicity. And then, of course, what are the alternatives? Is it safe to recycle? How to phase these things out? It's certainly not good to dump them on the edge of the stream. But what do we do to come up with a greener alternative? And there's certainly room to suggest making these things without PFAS. There's room for a green chemistry approach to make these things extrude at temperatures where you don't need PFAS in them. And with that, I think we'll end the next slide. Lots of acknowledgements, Heather, for all the work she does on this, but also a bunch of people that are actually on the ground. I mean, this is what Kristen does. She's out there on the ground with these guys. Jeff is at the Ecology Center, Tracy and Kyla was mentioned, but a whole bunch of other folks, especially our friends out in on the front lines trying to get these things passed through civic boards, school boards, and township boards to try to fight the turning of grass into turf grass, and of course the other agencies there that are involved.
And we're happy to take any questions, and I will stop the share and mute.
Great. Great. Thanks so much, Kristen and Graham. Next we have, if Ayesha could begin her screen sharing, We have three presenters for the next session. So Ayesha Kan is a graduate from Boston University with a BA in Applied Mathematics and Statistics. For a decade, she worked at Vitamin Water in New York City. And after moving to Nantucket, Massachusetts, she worked for local surgeon, Dr. Leopold. Currently, Ayesha, her husband Nate, and their two young kids live on the island of Nantucket, Massachusetts, where Nate works as a firefighter and Ayesha is a stay-at-home mom. Nate was recently diagnosed with testicular cancer, with Nate now in remission. And in researching more about his cancer, Ayesha found out about PFAS and its connections to AFFF and the firefighter gear. She co-founded Nantucket PFAS Action Group as an educational resource about hazards of PFAS and a space for the local community members to openly discuss concerns, thoughts, and experiences. She will be followed by Courtney Carrigan. Dr. Courtney Carrigan is an exposure scientist and environmental epidemiologist who conducts biomonitoring and health studies for a wide range of populations, including workers and communities exposed to contaminated drinking water. Her research has contributed to public health interventions aimed at reducing exposures to flame retardants, PFAS, and arsenic. She helps lead the firefighter Turnout gear PFAS study funded by the Toxic Use Reduction Institute, as well as biomonitoring studies funded by EPH and NIH, investigating PFAS exposure and immunotoxicity for communities impacted by drinking water contamination. Dr. Carrigan is on the organizing committee for the National PFAS Conference and helped found MSU's Center for PFAS Research. She serves on the Environmental Health Research and Surveillance Guidance Panel for the Michigan Department of Health and Human Services, as a liaison for the National Academy of Sciences, Engineering and Medicine Guidance on PFAS testing and health outcomes, and as a scientific advisor for the Center for Disease Control Agency of Toxic Substances and Disease Control Registry Community Assistance Panel for Peas Tradeport. She will be followed by Jamie Honkawa. Jamie is a co-founder of the Nantucket PFAS Action Group and professional digital marketing and communications strategist based in Los Angeles, California. She's developed major marketing campaigns for the Walt Disney Corporation, Fox Broadcasting Company, and Princess Cruise Line. She recently joined Public Employees for Environmental Responsibility, or PEER, as their external communications director. In July 2020, she joined forces with her best friend, Ayesha Kan, to create the Nantucket PFAS Action Group, a community group and educational resource for Nantucket residents who are dealing with PFAS contamination. Together, they are working on local, state, and federal PFAS projects with the goal of driving awareness and education about these toxic chemicals. So welcome, and I'll let you take it away.
Hi, Tiffany. Thank you. Thank you very much for the introduction. And thank you to Namoa for inviting us to share our stories. And so my name is Ayesha Kan. I'm joining you today from Nantucket. And I have to give a shout out, anyone from Nantucket, I have to give a shout out to Roberto. He's in the audience and he's our health director, and we're very lucky to have him. So hi, Roberto. So this issue is a very personal one. It has a lot of personal meaning to me. In late 2019, as you heard, my husband, Nate Barber, a 38-year-old father of two young boys and captain at the Nantucket Fire Department, was diagnosed with testicular cancer, which was linked to PFAS exposure in the fire service. This was the first time we had ever heard of PFAS and where our journey began. It was through our vast network of scientists, firefighters, nonprofits, advocates, and community members that we really started to learn about this global environmental and public health threat. We found out that PFAS were in Class B aqueous film-forming foams, also referred to as AFFF, as well as firefighter gear. Next slide. Oh, yes. According to the International Association of Firefighters, cancer caused 66% of career firefighter line of duty deaths. That's from 2002 to 2019. We had no idea that Nate was just one more diagnosis in an alarming countrywide trend. Yet we are the lucky ones because my husband is still alive, and therefore we can speak up for those who no longer can. Firefighters eat, sleep, work, and exercise in a house that is saturated in PFAS dust. Forever chemicals are on every surface they touch. Firefighters are known to have above average levels of PFAS in their blood. And so in order to limit my husband's PFAS burden, we decided to eliminate unnecessary exposures to PFAS, which actually proved to be an extremely challenging task. As consumers, we trust that everything we buy has gone through rigorous testing and safety protocols. We believe that the agencies meant to protect us are doing their jobs. The PFAS manufacturers have stripped consumers of their inalienable right to choose what goes into their products, their water, their gear. Next slide. At no point were firefighters given any guidance on managing, handling, replacing, let alone the health issues associated with AFFF or their gear. There were no warning labels. If anything, many firefighters like my husband, Nate, were actually told AFFF is fine. It's just like soap and water, totally safe. So as you can see, a lack of PFAS information has actually led to some situations that really, truly could have been avoided. Repurposing PFAS gear into purses, dousing each other with AFFF, putting babies in gear without any barriers. So PFAS, it really highlights a problem in our regulatory system and process. With these chemicals in our commerce, the burden really is falling onto us, the people. While we wait for regulations, firefighters like my husband and his 1.2 million brothers and sisters have no choice but to put on their PFAS-laden gear, handle firefighting foam, and continue to be exposed to these chemicals to help all of us when we call upon them. Exposed community members and firefighters have so many questions. And in our quest to seek answers, we were lucky enough to connect with Dr. Carrigan, who is here today to share her expertise on this multifaceted and complicated issue and topic. So I will turn it over now to her, and thank you all for listening to my story. Thank you.
Hi everyone. Thanks, Ayesha. So I first met Ayesha. I am from New Hampshire originally, and got involved at Peas, I guess about 7 years ago now. And I provide, among other things, technical support for communities with PFAS contaminated drinking water. So I was connected to Ayesha because they were testing PFAS in drinking water at Nantucket, and also because she had this concern about PFAS in firefighting gear. And we are both BU alum, and it's just really been a pleasure to work with the Nantucket Pfas Action Group and the fire department. So I'm very honored to be here today. All right, let's see if I can advance a slide. All right, so we know that cancer incidence and mortality are elevated in firefighters. So this is a list of cancers that have been found to be increased in firefighters from a recent systematic review and meta-analysis. So the ones on the left are those that were found to be significantly elevated, and the ones on the right were suggestively elevated. And there's been a lot of interventions to try to reduce firefighter exposure to carcinogens. We know that firefighters have elevated exposures to PAHs and smoke and soot. And the interventions that have been put in place are use of SCBA breathing apparatus, laundry systems to remove the PAHs from the gear, and specialized gear rooms to separate the gear from the firefighters in their living spaces. We also know that firefighters can have high exposures to diesel fumes and particulates from the fire trucks, and interventions in place for that include tailpipe exhaust systems and changes in firehouse layouts so that, again, the living areas for the firefighters are separate, and to keep those carcinogens away from them as much as possible. We know that PFAS we now know that PFAS are in aqueous film forming foam, a firefighting foam used to fight fuel fires, and have been used all over the place. And that I think we now believe that the main exposure pathway for firefighters from AFFF when using it is through inhalation, because most of the foam actually doesn't make it to the fire. A good portion of it is in the air. So interventions to reduce firefighter exposure to AFFF include now making sure to use SCBA and PPE when using or training with the firefighting foam, and safer alternatives such as fluorine-free foam, which I think are just now, starting to be used some places in the US. All right, so to take you through a quick timeline sort of when I, probably not as far back as it should go, but in 2008, there is a study showing elevated cancers in Massachusetts firefighters that came out of the University of UMass Lowell. In 2011, elevated PFOS and PFH-XS were identified in firefighters enrolled in the See It Health study. In 2012, a probable link was determined for PFASs and testicular cancer, or for PFOA and PFOS. Elevated PFAS concentrations were identified in firefighter blood in 2015 in two populations. One was in Australia and one was in Southern California. And in 2016, elevated PFH-XS blood concentrations identified at Peas, so people who drank the AFFF contaminated water at Peas. So we know AFFF, PFH-XS is a marker now of AFFF exposure. Around that time, I met Lieutenant Paul and Diane Cotter, and they were concerned about, Paul had been diagnosed with prostate cancer, and he was a firefighter in Worcester, a career firefighter there, Worcester, Mass. And they asked the question, could his prostate cancer have been contributed to by his wearing turnout gear and the PFAS in turnout gear? And I thought that was an interesting question. I told them I didn't know the answer, but it sort of started me getting interested in this question. So this is actually from the textile industry showing where PFASs are used in textiles. And you can see that PFAS polymers are used quite widely, but also non-polymers, it says they were discontinued, and now that replacement chemicals are being used ongoing. And you just heard from Graham, but Graham has also been working on this question as well. He published a paper recently, or a couple of years ago, noting that this is another exposure pathway for firefighters and finding high levels of fluorine in firefighter turnout gear using Piggy, and also quantifying some PFASs using GCMS. In 2020, there was a paper showing levels of PFOA in turnout gear. So this is going back to 2003 all the way up to 2017. And what you can see is higher levels of PFOA in gear, both the outer shell, moisture barrier, and in one case, the thermal layer prior to 2010. And then those levels get much lower after that. A team at Harvard University found elevated levels of PFAS in fire station dust. And the levels were especially high in the gear room. And I think they also did quantify PFASs in the gear itself. And then we have a new study with Jennifer Field and Graham Peasley and her group largely looking at the disposition of fluorine on new firefighter turnout gear. So I'm going to share those results with you now. These came out in December. So I actually took a lot of the data from that. I did the exposure, or I guess I didn't actually do the exposure assessment. We thought about doing an exposure assessment. So we have some notes about why that's hard in the paper, but I took the data and I put it into graphs. So if you go to look for the paper, you won't see these graphs, but if you ask for them, I can share these slides with you. So we saw that there were higher levels of, so the gear was analyzed, so let me just go back really quick. Sorry for not being more clear. So this is just showing the outer layer, the thermal layer, and the moisture barrier. So this is the layer that's against the skin. Sorry, the thermal layer is against the skin. It goes, usually the moisture barrier is in between the thermal layer and the outer layer. So the outer layer is on the outside, then you've got the moisture barrier, then you've got the thermal layer. Right. And so she analyzed using QTOF and GCMS, and it was also analyzed using Piggy. Right. So this is results from the GCMS and QTOF analysis, and what we saw was higher levels of volatile PFASs in the outer layer and the moisture barrier. In all cases, the volatile PFASs were higher than what we saw for non-volatile PFASs. So your non-volatile PFASs are like your legacy PFASs, like your PFOA, PFOS, etc. And your volatile PFASs are other PFASs. So I have another figure on that. From an exposure perspective, I think it's interesting because exposure pathways might be different for volatile PFASs, which might be more likely to volatilize and move around than non-volatile PFASs, which might be less volatile, right? All right, and then just note the scale here. So total fluorine levels are much, much higher than what we were able to get off, what Jennifer's group was able to get off using the methanol extraction technique that they used to quantify PFASs, the volatile and non-volatile PFASs in the gear. So just to note that big difference, we don't know, how much, how much the other fluorine would come off. All right, and then here we're showing the different layers for each of the different types of gear. So this is 2008 gear. So this was all never worn gear, which is a little tricky to get a hold of. And the rest are the 2019 gear. And you see a little bit of a different signature between how much PFAS is, volatile PFAS is versus non-volatile, are in the outer layer, moisture barrier and thermal layer. But we were able to see some in the thermal layer. And her group thought that the portion that I've labeled PTFE, the moisture barrier portion that's labeled PTFE, that this was a PTFE fluoropolymer film that was in these moisture barrier components. All right, so here it is by PFAS. So if you like to look at the different PFASs, now I've got 2008 the second down. So just notice that difference. And what you see with the 2008 gear, and this is the non-volatile PFASs, is the signature looks quite different than the 2019 gear, which has a more similar signature. And so what we see is that the 2008 gear contains low levels of extractable non-volatile PFASs like PFOA, PFOS, PFDA, PFBA, and so forth. And the 2019 is a different mixture. It's got PFBA, PFHXA, PFHPA, PFDOA, PFBS, and actually some PFOS was also found in the 2019 gear. All right, so now note this change of scale. So I'm just going to do it one more time so you can note the big change in scale. Right. So what we see is obviously the big change in scale. We see a really, again, a very different signature for the old gear compared to the new gear. And we see that these two 2019 pieces have a similar signature, whereas this one has a different signature. The 2008 gear was predominantly FTOHs, FOCs, and FTACs. The 2019 gear was predominantly 6,2 FTOH and MEFBSE. And you see that is mainly in the outer layer or the moisture barrier for this newer gear. All right, so this is summarizing what I just said, so I'm not going to say it again. I'll let you look at it real quick. I'm going to move on. And then I just thought it was fun to kind of go and look at the different studies that have come out related to these questions over the past 10 years or so. And I think this comparison is really hard to look at what you see in the blood of firefighters. So the Australian, Southern Californian, San Francisco firefighters. You can see a lot of different PFASs. So PFOS and PFHXS are the PFASs that we see in AFFF exposed populations, right? So this is a signature of AFFF exposure. And then you also see all these other PFASs that might be a little bit puzzling. Some of them might be in AFFF and some of them might not be. You see, if we look in dust in the Chinese textile factory, you see some of these, some overlap in PFASs. If we look at the gear room dust and the turnout gear wipes from the Harvard study, you can see some of these PFASs showing up. And then this is our new study that used these advanced techniques that Jennifer Field's lab can use. And you can see that we do see all of these PFASs that were found in these different studies. Okay. So the way I think about this as an exposure scientist is that the potential is there for exposure from turnout gear. When I think about this from, what could get through the skin from dermal exposure, we're thinking about, well, what can come out of the moisture barrier and migrate through the thermal layer, or if it was already in the thermal layer because it was actually maybe added there for some reason, what could actually then get into the skin that way. And firefighting, obviously, there's very high extreme temperatures. And so figuring out exactly how much can get onto the skin is a little bit tricky, right? Because the method we use with the methanol extraction, you might think about that as how much PFAS could come off the gear over its lifetime of use. And then you've got the PFASs that could come off the moisture barrier and the outer shell and get into the dust. So thinking about that Harvard study that was quantifying PFASs in dust. So this is an incidental ingestion pathway hanging around the firehouse, or wearing the gear. And we all ingest a little bit of dust every day. So it's an exposure pathway that occurs. Inhalation could also be a potential exposure pathway if it's volatilizing off the gear into the firehouse, or if it's volatilizing off the gear during the fire. They usually take their SCBA off after the fire, still wearing the gear. The guys were telling me they wear their gear a lot, not in a fire, just going around town. So that's another potential exposure pathway to consider. But we don't know how. We don't really have enough important information to inform exposure or risk right now. We don't know how much reaches and passes through the skin. We don't know how much is inhaled and accidentally ingested during use of the gear, and having gear in the firehouse. And I just thought I'd mention quickly that we just had a paper come out last week. Same group of folks. We did find PFAS in face masks, right? We've all been wearing face masks during the pandemic. So this is showing PFAS that were found in some different types of face masks. So like your N95 face mask. These are a bunch of different cloth face masks, these RCs. SUD, I'm pretty sure this is like a medical, that you'd wear in the doctor's office, the medical grade face masks. And this is the firefighter face mask. And this is just a heat map, but these levels were quite a bit higher, like an order of magnitude higher in the firefighter face mask. And we did find when I did an exposure risk assessment for that, which had a lot of uncertainty because I don't make a lot of assumptions, it did trigger risk if it was worn all day using a moderate or high activity level. So something to think about also. The fact that it was in all these other face masks was, I think, a bit surprising, which is part of the reason that we did the paper. Thinking about dermal exposure and sort of circling back to Ayesha's story about testicular cancer. So we know that chemicals absorb differently from different parts of the body. So the scrotal area, this is actually for pesticides, can absorb more of the chemical than other parts of the body. And we know that testicular cancer is elevated in firefighters. We do know of a famous case of elevated scrotal cancers and white chimney sweeps that was linked to PFASs. We know firefighters also have elevated exposure to PFASs, linked to PAHs, and that firefighters also have elevated exposure to PAHs. If PFAS is shedding from the gear into the thermal layer and contacting the skin, as the limited data suggests, then they may be increasing firefighter risk of cancer and other PFAS-related health effects. So thinking back to how exposure to multiple carcinogens can increase risk, for example, smoking plus asbestos exposure doubles the odds ratio for lung cancer. All right, firefighters want PFAS-free gear. So something that's become available is this PF0 turnout gear. It has no PFAS in the outer or thermal layer, as confirmed by Graham Peasley. But it does have measurable fluorine in the moisture barrier, so that PTFE layer. And we are currently doing research to compare PFAS exposure and risk for the old and the new gear in Nantucket and Fall River firefighters. Right. Another thing that we don't know is that, well, or we do know rather, is that the life cycle, right? So PFASs are created when in the production of PTFE and released into the environment potentially, and can get into, can result in human exposure, both potentially for the workers and also potentially for people from drinking water and so forth, fish consumption. One thing that struck me when I was in the firehouse is that they're taking a lot of care to wash their gear, as I talked about previously, because of the concerns about pHs, but that PFASs could potentially come off in wastewater of the washing machine and go into your wastewater treatment plant, where we know currently they're not being able to be removed and just pass through into the effluent and into biosolids. Also that they have these really neat dryers now, but at least in the Nantucket firehouse, it's just venting right outside with no filter on it. So it's another potential way that it can get into the environment. We know firefighters are requesting PFAS blood testing. This is another area that I work on quite a bit is, I do a lot of biomonitoring and have developed some resources. So I wanted to share those with you guys real quick because this is what we're going to be sharing with the firefighters. PFAS blood tests allow people to better understand and mitigate their personal exposures, and they can share their results with their clinician as a risk factor and for consideration and to consider medical screening if their exposures are elevated. So we have a tool. We developed a website, myself and Laurel Shader, who's also at the conference, and Phil Brown, who may also be there at Northeastern. We developed a tool called the Pfas Exchange, which is a website It has a lot of tools for PFAS impacted communities to try to help them. And it does have this really neat what's my exposure tool where you can put in information from your blood report or your water results, and it will give you context switch report back and tell you where you fall in relation to some different comparison groups and benchmarks, and make some suggestions for reducing exposure. We do know that improved medical screening in PFAS impacted communities can help identify early disease. So this was an op-ed that was published in Dermal Health News last year that highlights a story from Sandy Winstelt, who had very high exposures through her drinking water, shared her biomonitoring results with her clinician. He considered it a risk factor. So when she came in a couple of years later with some strange symptoms, he very quickly diagnosed her with thyroid cancer, and she was able to be treated quickly and has a good prognosis. And she talks about it like, you know, smoking is a risk factor that our physicians ask us about. So why can't this be informative to them as well? And her story really highlights that it can be helpful. So we've developed medical screening companion documents for PFAS impacted community members and their clinicians that are available on the resources page of the Pfas Exchange. So I just wanted to highlight that. There's other fact sheets there you might find helpful as well. And I help organize, along with Phil and Laurel and many others, the National PFAS Conference. So the third one's coming up in June in Wilmington, North Carolina. So just a plug if you want to come. Registration is now open. And I'm going to hand it over to Jamie.
Awesome. Thank you so much, Courtney. We will absolutely be at the PFAS conference. Can't wait. So hi, everyone. I'm Jamie Honkawa, the co-founder of the Nantucket PFAS Action Group. I'm really excited to join you today from Los Angeles to share some of the work we're doing with PFAS and firefighter turnout gear. So as you heard, there's a lot that we know about how PFAS impact the fire service. And we know enough at this point to start making proactive decisions in the interest of public and environmental health. Ayesha and I have done a real deep dive into PFAS, and sometimes we forget, as I'm sure many at this conference do as well, but that this information isn't actually common knowledge. There's a significant communication gap between the PFAS research and science world and the world of the firefighting community and the general public. And helping to fill that communication gap was really the genesis of our group. We wanted to be a resource and spread information about PFAS through our website, social media, through press, and speaking engagements like this. Since Ayesha and I started out in 2020, we've worked with the Nantucket Fire Department's Deputy Chief Sean Mitchell and Fall River firefighter Jason Burns to help pass IAFF Resolution 28, which works to remove the PFAS industry's influence on the union. This resolution, along with Resolution 31, which advocates for the removal of PFAS from firefighting gear, passed with 99% approval from the voting body, which really speaks volumes to the appetite that firefighters have for PFAS-free gear alternatives. We also ran a campaign to solicit letters to the NFPA to remove an outdated UV light test that calls for PFAS-specific materials to be used in gear. And to this day, this is the last remaining hurdle to fully remove these forever chemicals from turnout gear. And amid all of this work, we have seen that an overwhelming majority of firefighters still don't know about their on-the-job PFAS exposures, and many don't even know what PFAS are. The dissemination of information is currently a slow trickle, and when 66% of line-of-duty firefighter deaths are attributed to cancer, we really need a fire hose. Next slide, please. So last fall, we decided to do more. We joined forces with Dr. Carrigan and were awarded a community grant with the Toxic Use Reduction Institute. Our grant has two major components. Next slide. The first is to learn more about firefighter PFAS exposures from turnout gear and to see if low PFAS gear is in fact a safer, less toxic alternative. We partnered with the Nantucket and Fall River Fire Departments again and took samples that are currently being analyzed. We'll have more information on this once we get that data back. Next slide. And the second component of our grant is to provide an educational resource to the fire service through a website we created, pfasfreeppe.com. For any towns or firefighters in the audience, we'd love to connect so we can all collaborate and learn together. This is truly a group effort. You know, it's been really incredible to see how this community of firefighters, scientists, research, Researchers, nonprofits, and community members are all uniting to find safe alternatives for our bravest public servants. Our firefighters deserve safe PPE, and we're ready to do what it takes to help them get it. Next slide, Courtney. And that's it. Thank you so much for listening and for inviting us to share our story today. Here's all of our contact information so that we can stay in touch. Thanks so much.
Great. Thanks to all of our speakers for all the awesome work that you're doing. So with that, we can open it to questions. Do we have any questions in the immediate audience? Sure. I probably have to mute this while we.
The other PFAS that are routinely analyzed for in groundwater samples. Sorry, I can do it again. Does anyone have knowledge of potential sources that would cause detections of 6.2 FTS, but without any of the other PFAS that are routinely analyzed for in groundwater samples?
Did you hear that question? Okay.
We did, but it's a hard one.
Do you ever find just one?
Only
mean,
if-
Contaminant, right? I mean, it's a pretty common.
it wouldn't be firefighting foam that does just FTS, though it's a component. It means that you have so much of that that the others aren't there. I don't know a sample like that, but it could exist, I'm sure. Have you got one?
I had one that had high 8.2 FTS. Yeah. And we went back and resampled, and it seemed like it wasn't real. Like it just wasn't a real result. So I would suggest resampling and doing field blanks. We do field blanks for every sample.
There is an interference for FTS on the LCMS spec. It's not too common, but it could have a false high. The other thing is it could be, if it's a groundwater sample, you could be at the fringe of a plume, and the fluorosulfonates would go faster than so for the short chain ones. So, but it's one of the faster migrating elements. So if you're at the edge of a plume, you might get that first, and if you go a little further into the plume, it might have all the other stuff coming a little later. But those are just suggestions. It's a hard question. Do you have any easy ones?
Is the mic on? It's on. Do you know of any of the PPAs that are not fluorinated that are still very effective at preventing the feathering and the other issues with extrusion of plastics?
I don't know of any that aren't fluorinated. We specifically looked for them, and I suspect that there are. But for this type of extrusion, the fluorinated ones were the ones they suggest. And for that very reason, that the fluorinated compounds go to the surface. It's hard to find other plastics that won't melt in with a plastic and mix completely. But the PFAS they don't like playing with anything. So they always go to the surface of whatever they're put into. And so for that reason, I think that most polymer processing aids that I've seen are all fluoropolymers of some sort. I'm sure they could make one, but I haven't seen it yet.
I think this is for Kristen and Graham. It seems that collecting a sample of the actual flow off of the field and analyzing that would be a nice bit of information versus monitoring wells, and then having a background of the precipitation to run that too, that hasn't impacted the field. Has anyone done that?
Are you offering? Where are you?
Well, I did the Martha's Vineyard study, so I'm curious. I'm still curious about how this has progressed since I did that study 14 months ago.
So the results that Kristen showed from Connecticut were done that way. They were on a direct runoff from the field. It wasn't a ground well, but they did not have, they did the before and after, which meant that the before was probably regular precipitation or regular outflow in that stream. And there was some PFAS already, but then they saw an increase when they looked afterwards. So that direct runoff has been done, but not widely, as Kristen has said several times. If we could get more samples, that would be helpful, but the cost for analysis is rather high.
Hi, thank you all so much for sharing. I guess I was just curious, what is sort of the preferred alternative for firefighting gear as you guys are hoping to shift away from PFAS?
Ayesha, do you remember that? So I don't know that there is not really a good one right now, right? There's, I believe, PF0 that removed PFAS from the outer shell, but it still has PFAS in the moisture barrier. That NFPA regulation is really a huge roadblock for manufacturers to innovate and to create gear that is fully PFAS free. So we're in a bit of a, stuck between a rock and a hard place of being able to get firefighters this PFAS free gear, but manufacturers not necessarily being able to produce it or create it. So if anybody wants to write a letter to the NFPA, please, please do. And we're just going to keep pushing to try to get as much evidence as we can to support making that transition. Ayesha, did you have something to add?
Yeah, well, highlights also back to, PFAS, of course, we want to get it out. And then we also want to know, what are they going to replace it with as well? I wish there was a better policy that protected us so that we, as we're asking for this to be removed, I hope they're not replacing it with something else, but that's kind of like this process that we're in. And it's tough, but we do want the PFAS out because, that's a given, but we also would love for someone to be testing what are they putting it, or the manufacturers to be telling us what are they replacing it with, because the firefighters are exposed to enough, and every way that we can eliminate exposures to harmful chemicals is, I think, a step in the right direction. And I think, if the brilliant researchers have anything to add, that's just Jamie and I, what we see and what we would like to see.
The analogy is turning an aircraft carrier. It just takes time. The industry is responding, but it will take 10 years to replace all the gear.
I was wondering if anybody was aware of any PIGI or other PFAS testing of oil absorbent pads, booms, or coated containment boom, which is another common thing that fire department personnel use regularly and are exposed to.
I've not tested those. That's a good question, and it is something that might want to be waterproof, so they may treat it, but it may also be just a plastic. But I'd love to test one.
Another logical possibility. I mean, it's ask yourself what it is, what could it be, what else would it be? So I guess that will put me to sleep tonight.
If there aren't any other questions, do the speakers have any questions that they want to pose to the audience? One more question coming to you.
Hello, thanks for great presentations. Just reflecting back on the presentations we've been seeing in the consumer product sessions throughout the past few days, there's been a lot of testing on different types of products like clothing, carpets, textiles. I was curious, the concentrations that we're seeing in the turf, are they comparable with the concentrations that we're seeing in other everyday consumer products, or are those concentrations greater or less?
I'll take a whack at that if you want, but I'm glad to let Courtney take that one too. It's again a hard question, but the levels we're seeing of individual analytes are not so high as we'd see in the studies with turnout gear, for example. Turnout gear is very highly impregnated with this PFAS. For the home outerwear, you'll get higher levels as well. The turf grass has a feature, though. We know we're missing a lot of fluorine there. We don't know what form it's in. It might be volatile. It might come off quickly. It also may be something we're not looking for with the LC-mass specs. So it might be only visible on the GC-mass spec and those sorts of things. And so there's parts that we know we're missing. And so I'd hate to sign off on saying there's just a few parts per trillion, because when we look at total fluorine, we know there's 1,000 times more than that. And we don't know if it's all going to stay there or whether it's coming off. So, and again, it's a question, are you going to wear turf grass? Probably not, but it's going to contribute to your watershed, and it's going to contribute a load. And the number of turf grass fields per year that we're putting in this country adds to non-point source pollution of this PFAS everywhere, and or rather large point sources. So I think it's an issue, even if it isn't as high as the fire. I think a shout out to the firefighters here that did that presentation. This idea of educating firefighters and putting out a brochure that they can all read, that's what needed to be done. And this is the group that's leading the country. This is fabulous. Make sure you remind me to send it to all my firefighter friends, because there's lots that would like to see that. It better be at FDIC this year, for example. So good job.
So I do see a question in the chat. It says there are numerous products in our homes and lives in PFAS. I'm overwhelmed. I'm also thinking of gear we wear to site inspections. What are your top 3 to 5 product recommendations to remove from our homes or workplaces?
Can I take that one?
That's definitely Courtney. Yes.
So stain resistant carpeting is my number one no. It's interesting. I bought this when we bought this house, and I could finally moved to the Midwest and could finally afford a house, right? We got a house that had no carpets. I was really excited because I was worried about fire retardants in the foam padding. I was worried about PFAS potentially in the carpet itself. And then I found out after we moved in that it's vinyl flooring, and vinyl flooring may have PFAS in it because it's made with plastic that has PFAS in it. And we also know that some flooring waxes have PFAS. University of Michigan did a study finding, those big waxers. So at least waxing machines that are used in like hospitals and schools and stuff can have PFAS in them. I'm not so sure about home waxes, but something to look out for. So yeah, flooring and carpeting is something I think about. Upholstery. So if your upholstery is treated with PFAS because it's stain resistant, you spend a lot of time on your couch. So that's something that we avoid in my home. I certainly don't use any Scotch Guard or anything like that on anything. I used to use it on my tent and my boots and everything. And now I don't do that. I used to use ski wax. I don't do that anymore. I'm careful about not exposing myself to fluorinated ski waxes. I'm careful about not exposing myself to fluorinated anti-foggers, right? I used to put that into my scuba mask, and I used to put that into my ski mask. I don't do that anymore. I'm very careful about that. PFAS can be in your makeup. Graham knows a lot more about that than I do, but it's not labeled right now, so it's really hard to avoid. So I'm wearing makeup today that I don't usually. There was another one in the home. We have, not Teflon pans. We know, I've read that it's not a big exposure issue. I haven't done the calculations myself. You're probably getting more PFAS from fishing your pan than the pan itself, but it's also a life cycle issue. So when we buy new pans, we buy non-Teflon pans. I'm sure I'm missing a few. Graham, does anybody want to add any?
I think that's a pretty good list. Maybe outdoor clothing or waterproof clothing. But the last one I would get is have your drinking water tested. what do you drink? Because most of what you get is what you drink or eat. And it's hard to test food, but drinking water is tested by people, and you don't have to test everybody's house. But if you test in municipalities, if you test Nantucket, you'll get the whole island at once. So you don't need everybody in Nantucket to test their well. But if you're in a city, see if the water's been tested recently. And if it isn't, see if you can get a few neighbors and you to get together and test one. It's worthwhile, because you could remove all these sources from Courtney's house, and yet she could be drinking from a contaminated source. And then it's, and it may be below regulatory limits, but I'd still switch to bottled water if it was anywhere near that.
Yeah.
So those sort of suggestions.
We don't do microwave popcorn, right? We do, we pop it different. So you could, I just Googled it, microwave popcorn popper. There's glass ones, there's silicone ones. There's lots of alternatives now. So I think most people who know about PFAS don't use your bag to microwave popcorn.
Yeah, I just wanted to add on to that. I mean, I think it was Allison who asked the question. It's very overwhelming. Oh, sorry. It's very overwhelming, especially if you don't have like a science background or anything. You're just a regular person, and all of a sudden there's this scary chemical. And so Jamie and I talk about this a lot. It's in addition to the big exposures, in addition to testing your water, kind of look for simple places that you can avoid it. You know, kind of like what you would call like a low hanging fruit. And dental floss, that's an easy swap. Things, you know, like your outdoor gear, that's an easy swap. Asking questions when you go to shop, asking them, is it PFAS free? Because a lot of times you'll see it say PFOA free, and that could mean other chemicals are in there. And looking to say, you know, does it have fluorochemicals? Things of these kind of tricky little words here and there, but you know, always feel free to reach out to us also, because I just don't want to overwhelm anyone, but at the same time, I think it's something we need to talk about. Otherwise, you know, we are sitting here continuing to be exposed and not know about it. And I think Courtney and Graham and everyone here has talked about this essential use, but also the life cycle. It's kind of something totally new that I never thought about. And, you know, even like a Teflon pan, you may not have a lot of high exposure that can be measured right now, but when that pan's made, there is a community that is getting insanely high exposures. And it just doesn't feel right that my no need for butter is harming a community, that I unknowingly am doing that. And then you may think, well, that's, you know, in Virginia and who cares? I live in Nantucket, but that goes into our water, that goes into our atmosphere, and that does come back to us. It goes into our food sources, it goes into our water, it goes into our rain. So we are all kind of united in that sense. So the more we can eliminate these products where we can, the better it is for all of us.
So I see two more things in the Q&A. One is a statement. It says NFPA is having their annual conference in Boston this coming June, maybe an opportunity. The other one is several people have said to drink bottled water, but how do you know that's safe? It's not regulated.
So it's not, but there are a lot of different places that have done some testing and they put it online. I myself, the New Hampshire actually put, you know, their bottled water testing online first. And so that is immediately where I sent everything. Because not everybody tests all the time, and people that do source water sometimes change their sources, I only buy reverse osmosis filtered water. And it's because it's too much headache to try and keep up. And sometimes it comes from a company that is stealing it from indigenous people when I can't get it somewhere else. And that is not so great. We need to work on this. You know, but PFAS are used to make the filters for reverse osmosis. So when we talk about essential use, there are some, and, you know, particularly, you know, N95 masks, you know, that's PFAS, people. Like, there's some uses that we are committed to right now, because we don't have better, but there are some uses that we don't need to do, risks we don't need to take, a little bit more into our water system that could put us over that regulatory limit, that little bit more that's cumulative, that's the difference between, you know, the poor little fish having the yolk sac or not. Like, that we need to be like really thinking about these things, and then thinking about that life cycle. How much is it going to take to recycle? If we determine that the turf is, you know, full of all of this PFAS and covers all this PFAS, or that it becomes mobile once it, you know, gets oxidized by UV light, how are you going to recycle that now? Because now that's like tons of hazardous material, and who is going to pay for that? Because the people who installed it will be long gone. They already took their money. So these are much bigger questions than just what does the test results show. So I appreciate you guys being together in the room and here with us now to talk about these things and begin these conversations. Because, if you think it's not in your blood, you're wrong. And if you think it's not in your water, you're probably wrong too.
All I was going to say is it shows we all have a lot of work to do. And I don't know when the next conference will be, but I think there's going to be a lot of work done and a lot to be done, and we'll have to be here.
We have another question from the audience.
I have a question on the safer alternatives to turf grass, because when Turi did their alternative assessment for turf, they found that it was the organically grown grass that was the safer alternative. And is that what you've been moving toward in your communities? And one reason I'm asking is I don't think I could sell that in my community, the organically managed grass. I think people want the plastic fields where I live.
Well, all I can say is I live in another community with a turf field, and it gets the most use. Why? Because there's not enough grass fields, organic or otherwise, around. And we want our children to be in sports, and we have our children in sports, and most communities need more fields to be able to, use them an appropriate amount of time. And that's one of the answers. Spend the money on buying another acre or 2 acres and get another field. So, but we need more space.
Small grants program. And I remember one of the other grantees a few years ago had one on how to, implement organically managed field. So if you think your community wouldn't go for it, it might be an opportunity to apply for a community grant and see if Turi can help you, help your community with that.
Thanks, Courtney. This is Liz Harriman. Just, all those materials are all on Turi's website. So feel free to go to turi.org and see them. And Holly, we'll talk.
Yeah, and also another thing to point out with the fields, that a lot of them are, managed by towns and schools. And, they say the use, if you put some nice organic routine policies and you aerate more and you sod more, you can get more usage out of it. So sometimes it's kind of looking into saying, okay, is this a poorly managed field? Can we manage it better? Can we put more resources? And a lot of times communities will say, no, we can't, yet a field is, $3 million. So we can put money into that, but we can't put money into better equipment, sharpening the blades more, lawn mowing more, flattening, leveling fields. That's something I kind of struggle with, is how can we possibly take some of that money, the couple $1 million, and put that into proper, better maintenance. But Turi has great case studies on that. And I think they were able to see a lot of increased usage for that, because, you may think, well, maybe it's no big deal, but let's just remember those are probably created in Dalton, Georgia. And again, another community that gets a lot of PFAS released when these turfs are made. And then where will we dispose it? And do we really want to recycle something with PFAS in it?
I would also add that, in these communities that are making these choices, they really look at the turf as being this durable replacement that doesn't take a lot of maintenance and it doesn't take a lot of water. And, it's not going to nitrogen load and we have to worry about nitrogen. But, if your natural grass is healthy, you don't end up with a lot of nitrogen in the water, number one. And number two, that we have technical academies and horticultural sciences and the NFL trying to switch from artificial turf to natural grass. So this is a place where we could look into it and reframe this as economic development, an opportunity for our students to be leading the way toward a healthier world for themselves and their children. So I really think that more than just saying it's less convenient, we don't have to mow, we're not adding water to it. I think we need to have a more forward-thinking approach and a more holistic approach about everything we're doing for our children and our community in this way.
Thank you to our 6 virtual speakers and our one live person who showed up with me today too. So you all are doing awesome work and